So, hello everybody. My name is Ville Koiste. I come from Sitra, the Finnish Innovation Fund. I'm not sure if everyone knows what Sitra is, but I can explain shortly. Sitra is a public fund that tries to support a sustainable future, accelerating business that has sustainable targets. So we support, for example, development projects, experimental projects that public institutions have, and then we also do some funding in the areas where we think that the society will benefit from. But I'm here to talk about e-health and the future regarding it, and I'm going to answer on these questions: why, how, and when e-health is going mainstream. So WHO describes that e-health is about improving the flow of information. Why I think this is important idea, or the way to describe e-health, is that we're moving to data-driven healthcare. So if we don't make the information flow more efficiently, something bad will happen. The information will become invaluable. So that's why we need to focus on e-health activities and make it a really mainstream way of offering healthcare services. So I would like to, at the start, I would like to describe e-health from patient's perspective. What is e-health actually? It's a great word, sounds fine, sounds great, modern, really sexy word, but still what it is in real terms. Remote consultation, you're able to get a doctor wherever you are, whenever you want. Through mobile phone, through your laptop, through that tablet, it doesn't matter. It offers you personalized lifestyle coaching and decision support. This means that it utilizes your personal health data from patient record, or for example, if you have downloaded data from your wearable monitoring tools, it can use those while you fill in the questionnaires, the surveys. And it makes you go further by yourself, so it enables you to be your own doctor in a way. But of course, you cannot be a professional healthcare specialist, but still it offers you more information and you can make more informed decisions regarding your health. Online booking is a natural way of booking services nowadays. When you, for example, go to a holiday, you book hotels online, you book train tickets online. But this isn't possible in healthcare, at least not today. Then there's health information management. Maybe you want to know what your blood pressure was last time you went to a doctor. Maybe you want to check something else, or maybe you want to add something. And this is something that we need to enable. Then, of course, communication. That is really important issue. You should be able to ask and get answers much easier than today. And virtual health checks and surveys sounds, well, the previous presentation was really virtual reality, but this isn't so deep. This isn't going so deep into the virtual world, but still it means that we can do certain kind of health-related checks and in places, for example, walk-in clinics that include certain kind of medical monitoring tools that are have the same standards as doctors have, etc. But I will explain them a little bit further in the later part of my presentation. And then sensors and monitoring tools, so wearable technology is going forward in a huge speed, huge pace, and in the future there will be wearable technology that is so good and so developed that it can offer us information that can be utilized in healthcare decision making. So why e-health is going mainstream? Well, first of all, we all know that the healthcare costs are rising. We need to find more cost-effective solutions if you want to survive and offer healthcare services to people. There are some examples about the figures. For example, it's really interesting to compare, for example, Finland's and USA's amount of GDP that they spend on healthcare services. So it's a quite huge difference. Still, Finland is close to the OECD average. But the future looks like that is going to be really dark, because healthcare systems are facing challenges. Aging population is something that we all know. Have attached a picture about the silver tsunami, as we also know this phenomenon. And as we can see from the level of 2000, in 50 years, we have more than like 3 times the amount of people aged over 60 than we had in the year 2000. So that will mean something critical and something very, very, let's say, how to describe it like in a way that it doesn't sound too dark, but we need to do something, otherwise the whole system will collapse in a way. So I wanted to offer you a certain kind of concrete example at the start, so you can understand what could this more cost-efficient way really mean. So case example, Virtuvel. It's a virtual online clinic in the United States. It's a quite new company, a small one, but it offers care for everyday illnesses. Based on a virtual or online service where patients can answer certain questions. It goes forward regarding what the answers have been, and then offers the patients personalized diagnosis. Sometimes it asks patient to wait, and then nurse checks the answers, and then comes back to the patient via email or calls, depending on the patient's preferences. But the whole process is done in 30 minutes. So, for example, a citizen can do this during his or her lunch break, or wherever she or he is. So it makes it really easy to access healthcare services. And of course, if while the person is filling the questionnaire or the health check survey, if it looks like that it's not possible to treat this condition online, or she should take, for example, a lab test in a lab or something else, of course it offers some kind of doctors to visit or whatever it is that is needed in her condition. So far it has 100,000 completed visits, and the average savings of a visit has been $88, so quite huge. And if we check this time saving, it's 2.5 hours if we compare the process from the beginning to the end, including the traveling time, etc. So this is a huge savings in time and money. And what is amazing from my point of view, I was really surprised when I checked this research that they have done. Of course, we have to be critical with these, but hopefully they haven't been over-exaggerating their results. But 98% of customers were willing to recommend the service to their relatives or closest ones. So huge results showing that Ehealth has something to offer. But what actually is our health, and which factors are affecting it? Healthcare is of course really important, but the healthcare system itself has only a minor effect on our health. Of course, in the beginning of our lives, it's really important to have a system where everything goes fine. And of course, when something traumatic happens to us, then as well. But most important factors are actually our behavior, lifestyle, and then genetics. These two have been really hard to follow. It has been really hard to get information from these two factors. Nowadays we have wearable technology, for example, different kind of monitoring tools. Medical devices are getting smaller and smaller and cheaper, so people with, for example, chronic conditions, they can buy them themselves, monitor their own condition at home, etc. Genetics. Huge things have happened as a few years ago genome sequencing was really expensive, cost hundreds of thousands of dollars, but now the level of genome sequencing price is $1,000, and it's going lower all the time, and we're expecting that in 5 years it's only like $100. So you can buy the tests almost from every corner where you can find pharmacies or whatever. So it will be a retail product in a way. So this means that we will get a lot of data, and of course big data is something that we all are probably familiar in one way or another. So in healthcare, what does it mean? Will we get data traffic jams or improved value and preventive care? So in the future we will have information and data from many sources. I have 4 examples here. Health data, that is the basic data that we always have been using, blood pressure, etc. Then there's research data, that is, for example, in Finland, the public records that are really high quality, and there's lots of it from many from many decades in a reliable form. Actually, most of them are in e-form already. So from Finland's perspective, there's a huge opportunity in this. And then the genomics area, I already described the development that has been happening here. So this is huge data wave or data tsunami that we're facing. And then, of course, these wearables, behavioral data. So if we continue our life like we are doing now, we just get data traffic jams. So we cannot utilize the data in a way that it improves our lives or it makes our healthcare more efficient. And therefore we need to think this system and healthcare, how do we provide health and care in many ways totally differently. And therefore e-health solutions could be a way to offer better health outcomes and more efficient care. We just need to make the flow of information improve, and that enables collaboration between different stakeholders and different care providers. One thing is important. Citizens are ready for e-health. Sitra has done a survey that included more than 1,000 Finnish citizens. And the results were really supportive, really encouraging. More than 70% wanted more e-health services. They think that e-health services are really beneficial for them. They really feel that it offers them more value compared to the old way of doing things. Same kind of results have been received from Canada, where PVC conducted a research or a survey. And as we can see, almost 80% of Canadians are comfortable with virtual monitoring. So figures are quite promising, and the same results have been received from the United States. Actually, it's really interesting to see that 90% want to self-manage their healthcare leveraging technology. So people really want to be more in the center rather a passive outsider in the healthcare. And that is something that we aren't enabling them today. So, for example, on this virtual case that I explained earlier, 74% of consumers are open to these kind of services. That offers huge opportunities for virtual doctors in a way. But what are the most important reasons people like e-health? Faster access to care. So you don't have to wait for a couple of hours to get the opportunity to meet the doctor for 20 minutes, and then the doctor is so busy that he or she has roughly time to hear what you have to say. So that is the main point. It saves money and time. In the virtual case, 2.5 hours was saved when the meeting with the health professional was done virtually. So it's really concrete evidence that it offers citizens more value when they are allowed to meet health professional online rather than they are forced to go to a certain clinic, etc. Health monitoring is easy. People with chronic illnesses have been asked that, how do you feel monitoring your condition at home? For example, diabetics are really facing this change really positive way, and have been happy to get bigger role in their own health management, as they can monitor themselves. They don't have to go so often to the clinic, and they don't necessarily have to meet professionals so many times. So it makes life much easier. For example, people who are suffering from illnesses that need more following. And communication with professionals. So there is a clear channel that makes the interaction between professional and citizen more open, and that is something that citizens value. But what about the professionals? Some say that doctors don't want anything new and they just want to keep their position at the same place and work in the same way that they have always done. It might be so, but we can see that there's happening some change in the attitudes of professionals, and especially among doctors. So 80% of US physicians believe virtual assistants will change healthcare, and virtual assistants are certain kind of decision support tools that patients and doctors can utilize. They help them ask questions that are relative to this symptom or disease, so the data is more efficiently used. But same amount of health professionals in Spain are really willing to use telemedicine if it would be available. So they would use it, but they don't have it. In Canada, about 60% of doctors believe that Ehealth will be part of their daily lives, daily work, but they think that it will take time. So, if I claim that e-health is going mainstream, I guess it's important to understand how it will happen. Well, this is at the core of the whole change, or the revolution, if I may say. E-health empowers citizens. Actually, in a way, it empowers professionals as well. But this e-health ecosystem, or e-health solutions, enable citizens to monitor their health, make more informed decisions, interact with the healthcare system, receive more personalized services. And what this will eventually bring is that citizens become active healthcare consumers rather than passive participants. This is a huge change for example, if I think about my relation between hospitals or doctors or the healthcare system, it has always been like that. Oh, I'm feeling sick. I go inside the system and then just wait what they ask me to do. What is wrong with me? Where should I go? I don't know. I don't have any opportunities to choose. They just tell me what to do, where to go. But eHealth could offer people more opportunities to be masters of their own health. And that is a huge change that is happening. People are realizing that maybe I don't have to be as passive as I have been. And that makes them more curious about their own health, about their own well-being. And that will bring people who are bring more people who are wanting to get eHealth services. Maybe the biggest change is happening outside the developed countries, outside the Western world. Because, for example, in Africa, there's areas, remote areas, that haven't been able to get any kind of health services. There might be some kind of traveling nurse who goes in a village once a week or once in a month and offers certain kind of, you just had a child, well, is everything okay? That's fine. But now, as we are going forward with this mobile revolution and people are getting smartphones, even in developing countries, smartphones are getting cheaper and cheaper. With specialized gadgets that we can attach to smartphone, we can actually do some medical measurements with our smartphone. So for example, I have an iPhone, I could measure certain skin illnesses with it if I had the right gadget with me. So this is a huge thing and brings new people wanting to get eHealth services. And that is an opportunity for healthcare providers to offer, for example, remote consultation services to the citizens of Africa. And this has never been possible before. And that's why we really need to understand this in a way that it offers opportunities to make the society a better place or the world a better place, but at the same time, there's the new business opportunities. So new business opportunities, new way of offering care, this will mean that we need new business models. But do we need also new institutions that will offer healthcare, offer these services? This spring, PwC published a report, and according to their research and work that they have been doing, they think that in the future there will be a huge challenge from new entrants for the traditional healthcare companies. This means that, for example, 3 car makers are interested in offering health services in some way or another. Same, for example, 7 retailers. Example from car industry is Ford, that is in the future they have designed that they will attach certain monitor tools in steering wheels that will follow your heartbeat. There will be cameras that are following your eyes, your skin color, etc. So they will download the information to your health record. And of course, if something happens while you're driving, they will stop your car, put it aside, prevent accidents. And from the retail side, Walmart already has walk-in clinics in their supermarkets. Walk-in clinics are small kiosks that include medical devices. So people just have their credit card, they swipe it, and then they choose which insurance they use, and then they go in and measure certain biosignals, for example, heartbeat, blood pressure, and this is free for them. So they can do the basic health check, traditional health check by themselves free. But if something alerting happens or the system notices that your blood pressure is high and something else is also on a critical level, it offers you a remote consultation opportunity to doctor. So people can also, in a way, finish their whole healthcare visit or doctor visit inside Walmart while they're buying their groceries. And this means that we might not go next time in the future when we get ill, we might not go to a hospital or a clinic. We go to Walmart, or in Finland, for example, S-Market. Maybe the most interesting challengers from outside the healthcare system are the tech giants. IBM and its supercomputer Watson is challenging doctors. There's been a lot of talking about this artificial intelligence, that it can be so much smarter than doctors, that, for example, in cancer care, it can make doctors almost useless. That is not my opinion, but there's a lot of talk about this, that what is the role of artificial intelligence in healthcare. Apple, Google, they have already started the healthcare initiatives, and it's interesting to see what happens next. There's a good picture from Samsung's media event, their vision of digital health. So it seems that these tech giants are combining wellness and healthcare. In traditional way, we see wellness and healthcare in a way distant from each other, and these tech giants think that these both are inside one big box. But as we all know, for example, Google, they don't have the skills to offer healthcare services. Apple don't either, and that's why it means that new partnerships across industries will happen. Apple and Mayo Clinics already published their partnership, which means that all the data that has been collected inside one's HealthKit data hub that Apple published will be used in Mayo Clinic's daily work when they meet patients. So this is really interesting to see where this goes. Will this same kind of partnerships happen in Finland? Which partners will move and create some kind of strategic initiatives? There's many talks in the field, and for example, these tech giants have been very active in forming and finding new partners from the field of healthcare. One really interesting area is this startup phenomenon that we have seen also here in Finland. Digital health startups are getting more funding than ever. This picture from Rock Health's report. Rock Health is funding digital health companies, and they have been collecting funding rounds that they have been seeing in the market, and the data is quite amusing and it makes you think that is there some kind of bubble going on? Well, we don't know. Maybe it's a bubble, maybe it's a signal about the opportunity that is hidden inside the healthcare revolution. But still, there will be new entrants in the market. I'm not sure will the biggest player be these tech giants or some new startups. Let's see what happens, but something is going to change. Here's an example from Finland. SLAS is one of the largest startup conferences in Northern Europe, and already international media has noticed that something is happening in Finland in the healthcare sector among startups. Health and life sciences was the largest industry track at last year's event. Sitra was actually a key partner in this health and life sciences track. So we're proud to see that it was the largest track. Second was gaming. So we beat Angry Birds. That was really good. But as New York Times and the Next Web say, health is getting more and more interest from investors. And this year, let's see what happens. Maybe health startups will be the biggest thing again. This is actually something that Sitra has been doing. We call this in a virtual clinic concept, in which we have been trying to combine different elements that are happening in the field, for example in Finland. And it is based on the idea that if we utilize the data that we have already, and in the future what we will have, we can offer new kind of services, and that will make the healthcare system more efficient. So it includes all the things that I have already mentioned: health information, personal risk assessment. So we already have this type of open health surveys in the internet. You can go on the website and it asks questions and tell you, yes, you have a headache, but I don't know what's wrong with you. Go to a doctor if you feel that it's necessary. That isn't helpful, I think. But now it can check your background, check your history of illnesses, and then offer you more precise information what might be wrong. It can ask additional questions and go a little bit further. But of course, there's this question that it never can say that you're healthy, go to bed, enjoy your life, if there's a possibility that something is really wrong. But still it helps it helps person to understand her or his situation much better, as we can utilize all the information that we have already collected. And of course, one important thing is the rich database of research and reference data that we have here in Finland. I guess I could say that we're a leading country in terms of health cohorts, meaning in the public health databases. The quality is really high. They have been collected in electronic form for tens of years. So now we have biobanks, and they have already millions of samples. All this data is available for us if we just want to use them. So from Sitra's perspective, this is something that we see that the future would look like. Of course, this is idea, this is concept that we have been developing with our partners, project partners, and let's see what happens. This is an example of the walk-in clinic that Walmart has. So there is a nurse or some person just who offers customer service, watches out the clinic, but people, they go inside and self-care their own diseases. So, when is all this going to happen? Good question. I'm not sure if I'm able to answer. If I was, then I would be really proud and amazed. But one fact is that Ehealth is already here. Why can I claim this? Well, let's look at some figures and facts. Telefonica, one of the largest telecom companies in the world, they have already 2 million Ehealth customers. Telecom company, just like Elisa or Telia Sonera here in Finland, they have 2 million customers in the Ehealth business area. This shows an example about the new entrants in the healthcare system. And then again, other example, number of e-visits. Now 100 million this year is 4 times the amount that we had in 2013. So growth is quite amazing. Kaiser Permanente, familiar, I'm not sure if it's familiar for you, but it's one of the forerunners in eHealth, and they have already 50 million e-visits last year. And the share of large employers, they're really important in this development. Already last year, 70% of large employers uses and offers some kind of telemedicine, also known as eHealth services. And then an example from Finland, actually one of Sitra's projects is the Finnish Student Health Services that has started to provide virtual doctor visits in certain cities. So it has been really popular, and some data from this project, it looks like something like 70% of the cases when a nurse needs to contact and make a remote consultation with a doctor, 70% of those cases can be solved with this virtual visit. The rest cases will be handled with traditional way, but still quite amazing number in Finland today, already happening. So, what will the future of medicine and healthcare be like? In 2012, The Economist said that the future will squeeze out the doctor. I'm pretty sure that something like this will happen. Of course, we need doctors as well in the future, but their role will be totally different. They might get more difficult cases as nurses and technology together. Technology is a tool for people. Technology can help nurses, for example, handle cases that more independently, and of course self-care, meaning that people themselves can, for example, have more opportunities in keeping themselves healthy than before. So we need doctors in the future, but their role isn't as central as it has been, as the patient comes to the center of the health system. That is really a huge change, and that is the revolution of healthcare. Patient will be in the center of healthcare. So, that was all from my side. Thank you very much.
Great, thank you, Ville, for the eHealth presentations. Any questions from the audience? You want to challenge Ville's views? All right, I got actually a couple of questions.
Yes.
There's lots of examples of what is going on
Yes.
in US and Canada and Spain and Latin America and so on. As a citizen of Finland,
Yes.
the thing is that what I see here is that we are spending hundreds of millions of euros for some systems like a patient's records or something like that. And the thing which bothers me a lot, so much money is going in, but the service level is getting lower and lower, what we are getting from the system. So why is this?
A question that could take quite a long time to answer, and maybe I'm not even the right person to answer it, but still, I understand your feelings, I understand your thoughts. Last Sunday there was an article in Helsinki Sanomat newspaper, and my colleague Matti Stiik said that it's amazing that people have to pay for the system that doesn't offer them service, at least a good service. And this is a true problem, and in a way, if I could say, I think the revolution will come outside the healthcare system, because dinosaur is a slow mover, and it's always when some revolution happens, and many new steps in technology happens, it's easier to build something totally new than try to change the old, when the size of the old thing that we have built is so huge. Hopefully this isn't going to happen, as I hope, and I really want that our public system can see the opportunities now and find some kind of understanding and collaboration so that we can go forward and build something that offers e-health services for the whole country, and we can utilize the data richness that we have here.
Okay.
But there's many problems, and it takes many hours to answer those questions.
All right. Second question, a bit related to the Finland, and Finland is one of those countries where your health information, every citizen here, the information belongs to the government, to the public sector. Some countries don't utilize the same approach. Do you think that we should also consider in Finland that the my health information is my information and I just pick up the best possible private sector service provider who will take care of my records?
I'm happy that you asked this, because this is a central question, and I think the data should be citizens owned by the citizens rather than the system. This is a crucial element if we really want to make a healthcare system that puts the citizens in the center. Otherwise, it's only like a system than before we had already. So data should be owned by the citizen.
Yeah. All right. One last question. We heard in one of the presentations that the Dr. Watson, the IBM computer, could pretty much diagnose. Having all the input for thousands and thousands of journals and diagnoses and doctor comments and so on, could pretty easily predict something which is as accurate as the doctors are doing. Are we now, when we are having the e-health systems, are we trying to kind of improve the system so that it would be even better than what we have today when it comes to those mistakes that somebody say wrong diagnosis?
In a way, I could say there's this supercomputer opens up opportunities for doctors. Nowadays, they already have decision support systems, but they cannot utilize information or such a huge pool of information as the supercomputer can. And this is how could I describe? This is something that makes the health decision making. Some could say we don't need doctors anymore, and they are lousier in making decisions than the computers. But we need human touch in decision making in the future as well. We always need some kind of outsider opinion. We need people who can evaluate qualitative data as well. Computers, they can learn already, they can make miracles, but in a way, from an ethic point of view, sometimes there are decisions that need to be done by human rather than computer, because it includes many things, emotions.
Yeah. All right, good. Thank you, Ville, very much for the presentation. Thank you.
Thank you.
All right, ladies and gentlemen, that was the last one for today for digital services. Next is going to be a streamed broadcast from, for every room here from the hosting organizer. And after that, there is going to be a buffet and some cocktails and everything else. So you don't have to stay in this room anymore. You can go any room you want to go, because it will be streamed in every room in this building. Thank you very much for coming to the digital services track, and I hope that you have enjoyed your day here and made lots of good contacts, and truly hope that the presentations also open up your eyes for the new ideas. Thank you very much from my behalf. Thank you.